Hello, my name is Jillian Maxcy-Brown and I'm a graduate research assistant at the University of Alabama. Today I'm going to share with you my findings from a consultancy with global communities looking at the gaps in access to safely managed sanitation that are present throughout the United States. These gaps are preventing the achievement of the United Nations Sustainable Development Goal 6.2. The United Nations Sustainable Development Goal 6.2 aims to achieve access to adequate and equitable sanitation and hygiene for all and end open defecation, paying special attention to the needs of women and girls and those in vulnerable situations. The United Nations uses the World Health Organization, or WHO, and the United Nations Children's Fund, UNICEF, joint monitoring program to monitor access to sanitation globally. The JMP service ladder is utilized to evaluate different levels of sanitation access for households. You can see that safely managed sanitation is defined as the use of improved facilities that are not shared with other households and where excreta are disposed of in situ or transported and treated off-site. The SDGs previously aimed to achieve access to basic sanitation for all by 2015, and although this goal was not completely achieved, there was notable progress made in improving access to sanitation globally. So now the current SDGs are aiming to achieve safely managed sanitation for everyone by 2030. The JMP data for the United States is primarily informed by surveys administered by the U.S. Census Bureau. The wastewater question was removed after the 1990 decennial census, so now wastewater and plumbing data are collected by the American Community Survey and the American Housing Survey. For example, the American Community Survey asks only about indoor plumbing and it doesn't ask about wastewater service, but there is current ongoing work to reintroduce the question from the decennial census to the American Community Survey. The plumbing data that they collect on the American Community Survey, it is limited though because it has a very high non-response rate for that question. And they also removed the option of a flush toilet from the answer choices in 2016, so that prevents tracking of changes to complete indoor plumbing past 2015. The American Housing Survey collects data for indoor plumbing and sewage disposal, but it's less comprehensive, with reporting data only from 11 states and select metropolitan areas. It doesn't have an extensive sampling of rural areas like the American Community Survey. And in 2015, the American Housing Survey added none as an option for the wastewater system, and there were 199,000 homes that fell into this category. All of these surveys rely on physical residences to associate the data, which excludes populations that are experiencing homelessness. The JMP data for the U.S. shows that there are 98.26% of U.S. residents that already have access to safely managed sanitation and 1.42% more that have basic service, but there's still 0.32% of unimproved, which is roughly 1 million people. Recent reports for rural and urban areas have started challenging this JMP data for the U.S., especially for the limited service and open defecation, which are both reported as having no one relying on these methods. There is also discussion that the unimproved service access estimation is an underestimation. For this study, I focused on the following types of gaps in safely managed sanitation access: lack of access to complete indoor plumbing, the reliance on failing septic systems, straight pipes, cesspools, failing outhouses, bucket latrines, and open defecation. Incomplete indoor plumbing is defined as the lack of access to hot and cold running water, a sink, a shower or bath, and/or toilet. In the U.S. Water Alliance and Dig Deep's 2019 report, Closing the Water Access Gap in the United States, they estimated that there are 1.4 million people lacking access to complete plumbing, while the American Housing Survey estimated in 2019 that there were approximately 291,000 homes that did not have access to complete indoor plumbing. While the majority of U.S. residents are connected to centralized sewer systems, there's about 20 to 25% of residents who are responsible for managing and treating their wastewater on site, which is conventionally done with a septic tank system. Failing septic tank systems are when a septic tank drain field is experiencing hydraulic failure or the system has an environmental failure due to inadequate treatment of the wastewater. The American Housing Survey estimated that 20 million households used septic systems in 2019, but it did not clarify if they were functioning properly. It is estimated that at least 65% of the land in the U.S. has conditions that are not suitable for conventional septic systems, which means that the residents must employ more expensive advanced on-site wastewater treatment systems, or they live without safely managed sanitation. On-site septic systems are not regularly inspected and data collection is limited, but we do know that septic tank systems typically last 20 to 30 years, and there's a very low repair replacement rate, which indicates that there are likely thousands of septic tank systems failing throughout the country. Straight pipes are pipes that discharge raw sewage from homes into yards, trenches, or other nearby surfaces. Some of the straight pipes have a tank for solid settling before they discharge the wastewater onto the surface, but not all of them do. There are some areas that also have community straight pipes which connect multiple households. And these straight pipes have been found in some poor rural communities where the soil and geological conditions prevent the use of the conventional septic system, but the alternative systems are too expensive and unaffordable for these residents. My recent study found documentation of straight pipes in 15 states across the country. Some households dispose of their wastewater into underground holes known as cesspools. The wastewater is discharged into a structure or no structure at all. These cesspools are intended just to hold the wastewater. There's no intention for them to treat the wastewater before it flows into the soil and eventually into the groundwater. Some places have large capacity cesspools that collect wastewater from multiple households, and cesspools are known to exist in Alabama, Hawaii, Mississippi, New York, Oregon, and probably more areas that just haven't been publicized yet. It's estimated that there's 88,000 cesspools in Hawaii. 43,000 of these pose a direct threat to water resources. These cesspools release approximately 53 million gallons of untreated sewage daily in Hawaii alone. Next is outhouses. Outhouses are outdoor buildings with toilets, but typically no plumbing. They can be operated anywhere from unimproved sanitation access to safely managed sanitation access, but they're only considered failing if they're not safely managed. These outhouses may not be safely managed if they were not properly installed, if the soil types are not conducive for outhouses, if the bedrock or the water table depths are too shallow, or if the wastewater is not properly contained. Outhouses are still a common sight in Navajo nations, Texas colonias, and parts of Alaska. There are also some residents that rely on the use of bucket latrines, sometimes known as honey buckets. These are large buckets with a seat attached. They're used in unpiped communities in parts of Alaska where the environmental conditions prevent the use of outhouses, but there are some households that primarily use outhouses and have honey buckets during extreme weather conditions or for use with elderly and children. The 2019 American Housing Survey found that there were 136,000 residences that had other sewage disposal methods, which would include outhouses and bucket latrines, but the limited data categories prevent adequate tracking of each of these throughout the U.S. Lastly, I investigated populations experiencing homelessness, many of whom must rely on open defecation or public bathrooms when they're unsheltered, or typically poorly maintained shared bathrooms when they are sheltered, which constitutes as limited sanitation access. These populations are not reported through many surveys since most surveys focus on physical residences, but the U.S. Department of Housing and Urban Development conducts a point-in-time survey every year for people experiencing homelessness on a single night in January. In 2020, the survey reported that there were 580,000 people experiencing homelessness throughout the country. Now let's look back at the JMP service ladder to see where the gaps that we just discussed fall. Incomplete plumbing, failing septic systems, and cesspools are all forms of basic sanitation. Straight pipes can be basic or unimproved based on whether there's a tank for solid settling before the liquids are discharged. Failing outhouses can be basic, limited, or unimproved, while bucket latrines are unimproved sanitation access, and populations experiencing homelessness use open defecation or limited sanitation services. In conclusion, the published literature shows that there are populations using limited and open defecation in the U.S., which is not reflected in the JMP data estimate. Literature also reveals that there are likely more residents with unimproved sanitation access than the roughly 1 million in the current JMP estimate. In order to fully understand the scope of unsafely managed sanitation across the U.S. and to inform work to achieve UN Sustainable Development Goal 6.2, multiple data sources need to be used to fill in the gaps of the nationwide survey data. If you're interested in looking into this topic further, here's a list of some of the references that I used throughout this presentation.